what works for your healthcare system may not work for Africa or Asia or where I live, because we have to factor in the four elements of care. One is economic sustainability
Yes.
for the patient, the healthcare system, for you, because you have to, as a private practitioner, you have to pay for the implants.
Mm-hmm. Yes.
Two is a man's vitality. How does the man value his ejaculation
Yes.
or incontinence or needing a catheter? Third is treatment durability. We all accept that with fractional deobstruction, it will not have the durability of enucleation or
Yes.
TURP, or,
Yes.
but it's all about balance. And the last part, which you and I talk about a lot, is how do we balance the window of curability to
Yes.
preserve bladder health?
Yes.
So if a man has, so let me ask, for a man who comes in who very high residual, the bladder is hypotonic, poor function, how do you have that discussion with him about a maximal approach or a fractional approach?
This case, the maximal approach, the maximal disobstruction. And then hold up the first indication for me. If a patient don't want to make the surgery more invasive, the mist is a possibility to better than the medication, because the patient needs to understand. But vesicle com hipocontractility, a large prostate, I agree that enucleation is the better. But in the office, the patients decide together, and he needs to understand.
Exactly. And it's all about also timing. Maybe at that time, for him, he is sick and he's frail and cannot undergo an enucleation, but you need to help him and help his bladder. So maybe you first start with a fractional approach, knowing that you will need to do a maximal approach later on. So once again, shared decision-making based on all of those factors.
When sometimes the patients don't have indication to make the general anesthetic and what do you do? I have patients with retention urinary vesicle hypocontractility, and I did Urolift 2-3 years ago, and very well resolved. Don't have this guideline European, don't have indication for anesthesia.
And have you had the same experience with Resume, or mostly, I mean, I know you're mostly focused on Urolift, but have you also seen that with Resume?
Resume, I have a patient with a prostate, with the prostate very large, vesicle very, very, very bad. And this moment, very good with Resume. Very good, very good. And patients don't want to make enucleation.
And I think that's an important lesson, which is one size does not fit all urologists or one patient. Doesn't fit all patients the same. Talk to your patients, understand your technologies. There are many ways to find solutions to prostates and to preserve bladder health. And this is a fun example here. I have never seen this, and I think this really reinforced the power of avoiding urethrocystoscopy.